Hi, I'm Ruth O'Regan from the University of Rochester. I'd like to talk about the poster I have here today. So this basically is looking at using BCI to identify premenopausal patients who have a very low risk of recurrence. So as we all know, soft and text showed that patients that had high-risk cancers or high risk enough to get chemotherapy or were very young benefited from the use of ovarian suppression plus an aromatase inhibitor compared to tamoxifen. But there's toxicity with that, and we've been looking for genomic assays that can kind of help do a better selection of who these patients are. So we have a group of tumors from the soft and text studies that we've used for analysis. And just as means of background, the BCI, which is made up of molecular grade index and the H/I index, has been used in postmenopausal patients to identify women that are at a very low risk of distant recurrence, which is at 5% at 10 years. So what we did here was we wanted to see if the same was true for premenopausal patients. So out of the soft text study, there was about 1,100 patients in this analysis. And then, as you call it, soft, they got tamoxifen, exemestane plus ovarian suppression, or tamoxifen plus ovarian suppression, and 900 patients from text were assigned to exemestane plus ovarian suppression, or tamoxifen plus ovarian suppression. The new cut point to determine these patients who had minimal risk cancers is 3.0, and then the current cut points that determine the other risk levels with BCI are 5.1 and 6.5. The primary endpoint was distant recurrence-free survival. And the median follow-up from this analysis in soft and text was 12 years in soft and 13 years in text. This table basically just shows the demographics of the patients. You can see that they were well balanced across all the arms. There was a fairly small number of patients under the age of 35. Most of them were older, well balanced for tumor grade, and there was a very small number of patients who had HER2 positive cancers. So if you look first of all up here, this is all the patients that were analysed, and you can see they're fitting into what used to be 3 risk groups. There's now 4, and this dotted line here represents these patients who have a minimal risk of a distant recurrence at 10 years. So looking at this, what the numbers were using this model and this new cut point, 17.8% of patients in this group were considered minimal risk, and 43.2% were considered low risk. In that group that were considered minimal risk, the 10-year risk of distant recurrence was only 2.3%. And in the revised low risk group, it was 4%. This group are the patients in soft who just got tamoxifen. In that group, the estimated 10-year risk of distant recurrence was 3.5% in the minimal risk group and 7% in the low risk group, as you can see shown here. In this group here, in the soft exemestane plus ovarian suppression or tamoxifen plus ovarian suppression treatment groups, so really all the patients on both studies who got ovarian suppression, the estimated 10-year risk of recurrence was only 1.7% in the low risk group and 2.7% in the minimal risk group and 2.7% in the low risk group. So that's essentially it, and this kind of just shows the estimated distant recurrence probabilities based on the different risks shown there. And here we're using a continuous SOAR, again for soft all patients, tamoxifen, ovarian suppression, and soft ovarian suppression and text. And what you can see here is the BCI goes up, the risk of distant recurrences goes up, as you can see shown here. So why this is important is because I think other genomic assays, including BCI, are identifying patients with cancers that are very low risk of recurrence, that for sure likely don't justify ovarian suppression and aromatase inhibitor, but may actually be a group that actually don't need endocrine therapy at all because their rate of recurrence is so low. Obviously, we haven't done that trial. It's been a long time since we've done tamoxifen versus placebo, but it does suggest these patients are doing so well that maybe they don't need any therapy.